think it's very important, first and foremost, to understand your own skin type. And a lot of time, I think people do not understand their own skin type. And each and every face has different areas, which are, some are the targeted areas, some are the natural oil-based areas, and some are the dry areas. I think first and foremost, people don't understand that. Then the skin changes as we age. A teenage skin or a skin of 30s.
Hello everyone, welcome to Let's Talk Aesthetics with Dr. Salma. I have another wonderful guest here, all the way from Karachi at the Padcon 2024. I have with me Dr. Seema Zia. Welcome, Dr. Seema Zia.
Thank you, and welcome to you also here.
Thank you so much. Thank you. So you're here for the Padcon.
I am one of the, I could say, one of the very senior members over here. My number is, I think, one of the initial ones. So I've been coming to these yearly. It's an annual meeting with a meetup with all my friends and doctors and colleagues.
There's an opportunity to reconnect with a lot of your colleagues.
To learn, to interact, to explore.
And to teach.
And to teach as well, yes, yes.
So you have seen over the years a lot of changes probably.
Yes.
What is your take on it? Like, what do you think the dermatology is at right now?
So dermatology is definitely always there and needed because it is all about pathology and diseases. But the way aesthetic has progressed and evolved, it's taken a leap.
Yeah.
And sometimes I feel that people are now more interested into aesthetic, which I call aesthetic dermatology, then they're more inclined towards the basic dermatology, which will always be there and always will be needed.
Yes.
But generally, I think the way people are getting very aware of their own selves, their profile, their personal aura, persona, aesthetic has really taken a different milestone.
What do you think is behind it?
I think wellness, well-being, how to project yourself in a more positive way, and how to impact and influence whatever you're doing in a positive way. And also, I think, well-being. We all know that generally also everybody is aware of their weight loss, fitness, exercise. And then obviously when it comes to that, you also want to have a very beautiful or a pleasant persona and profile. It helps. I think it makes a difference.
Absolutely. But what do you think is actually really stemming from? Is it like a negative dysmorphic kind of syndrome, or is it like a negative perception that they're trying to address? Or is this like a positive wellness overall, holistic view of themselves, trying to better themselves physically, mentally? Where is really stemming from?
I think it should be a very holistic view, but unfortunately it's getting very dysmorphic. I feel, because I think aesthetic has gone into the hands of from professionals to people who are probably not as well equipped to handle it as yet, and it has given them a little. I feel it has given a little a downside to the field, to the technology, because everything is not promised as it is. A lot of time it's over promised and over ambitious expectations, which normally people initially try to sell themselves, but if it is in the hands of professionals and qualified people, they will always give you a very realistic expectations and a realistic approach.
Not just try to sell you something.
I think that link has been missing, and too much is being expected. It's been considered as a magic wand, which it is not. It's not. It's a process.
Yes.
Like everything, even if you go to a gym or a nutritionist, it's a process which takes a time.
Absolutely.
And it's an awareness that how you have to approach yourself. Each and every individual has to be approached differently. And that link I think is missing.
You're very right. I think a lot has to do with social media influences. The so-called influencers,
So I feel when you see these influencers, who are fabulous, but then everybody thinks that whatever the influencer herself looks like, probably when they come into these treatments, they will start looking like them as well. And then the promises are made which are very unrealistic.
And that's where the whole Hollywood was sort of built on it. Everything in marketing is built on it.
Yeah.
The picture is shown, but then they don't know how much processing has been done on it.
Exactly.
So all the models that look beautiful and perfect, they don't necessarily have the perfect skin.
Probably, yeah.
Right?
Yeah.
So unfortunately, you're right, and I'm glad you brought that up, because there's a lot of people overselling to follow a certain trend that may not be good for people.
I feel just not in Pakistan, globally, there is no parameter how to contain or qualify to be a professional in aesthetics.
Right.
So
It's an evolving field.
yeah, I think people are still searching how to kind of have a boundary, and how to have some kind of a parameters of how to go about it in terms of treatment and in terms of practice. In Pakistan, still there's a lot being discussed, and we do have come up with a diploma of aesthetics, which is a 2-year certified diploma.
Nice.
And I hope once we have that kind of a
infrastructure for it.
Yes, I think we'll have more qualified people having more of a professional-based expertise, where people will not be disappointed by unrealistic, false promises. Yeah.
So you've been in this field now for some time. You've kind of seen ups and downs and all new trends. Is there something still on your heart that you really want to do? Like you have a passion for?
Actually, I'll be honest with you. I am pretty disappointed globally and in Pakistan the way aesthetic has gone into hands of each and every one. If it would have been contained within the medical practice, within the doctors, I think it would not have had such false expectations. And now the way everybody's embarking into it with a very few professional training has given it a very wrong, yes. And I feel very sad about it because it is a beautiful field. Lots can be done, lots can be promised, but each and every person has to be diagnosed, and then you have to tailor the therapeutics.
Unfortunately, a lot of these things are being done in salons, without any kind of proper training, no concept of hygiene, no concept of safety. And how do we educate our public? How do we actually bring this known? So where make sure people are the one who take action about it.
So I think we have to divide aesthetics and cosmetology into two different parameters. Two different. Cosmetology is all about your personal beautification,
right?
And aesthetic is all about when medically, science is behind that technology. Like we used to have products like cosmetics and cosmeceuticals.
Right.
Cosmeceuticals are the medical-based products, which are used for cosmetic enhancement, right?
But only prescribed by, used by professionally.
Exactly. So I think the two domains have to be clearly identified. One has to be beauty and cosmetics, and one has to be science and aesthetics.
Right.
And there can be a merger and an overlap, but then the whole course of training has to be very different.
Very clear. Very clear. It has to be very clear, streamlined. It's important for people to understand what are they really getting into and how they're getting it. So you're very right about it. So I hope through your work and through we can bring more awareness to people about aesthetics, about cosmetology, about cosmeceuticals. But how do we empower people? Like we educate them. But let's talk about skincare. So what is it that people can do on their own if we are to just give them a little power? What are some simple things that they can do to feel good, to feel beautiful? Because that's what it's all about at the end of the day.
So I think it's very important, first and foremost, to understand your own skin type. And a lot of time, I think people do not understand their own skin type. And each and every face has different areas, some are the targeted areas, some are the natural oil-based areas, and some are the dry areas. I think first and foremost, people don't understand that. Then the skin changes as we age. A teenage skin or a skin of 30s will be different than the challenge of a 40-year-old or 50-year-old. And when women, after they have this menopause, then this all
a whole
different
story.
Yeah.
Right.
So I think the skin changes with age, with season, also genetic predisposition to certain, you have a rosacea skin, or you have an acne prone skin, or you have a seborrheic skin. So all these things I think has to be, so I think first and foremost, everybody has to understand their skin type.
Right.
And I think for that, you have to go to a dermatologist who is aware of skincare. Not many dermatologists. A lot of dermatologists are basically focused into the pathology of the skin. They do not know about skincare.
Yeah, right.
Yeah, that's again, it's another subject altogether.
Yeah.
So I think as things are emerging and people are getting challenged and people are getting aware, I think all these things will definitely fall in place.
You mentioned another important thing, menopause. Especially women, when they are going through perimenopause, and once they hit menopause, it's like suddenly a light went off. Right? Suddenly they have a whole bunch of changes in their body, right? And they're not prepared for it. They don't know what is happening. Nobody's educating them about it and how it is affecting their skin, their bodies.
Yeah.
Right? So, do women come to you with menopause and suddenly their skin just overnight changed?
You know what? It's such a unenchanted area that a woman well-being is not even addressed properly. It's now, as the women are getting empowered, they are beginning to understand about themselves, their bodies, and the physical changes. A lot of things was considered as a part of aging, where it could be taken care of. A woman's health at the time of menopause is a huge topic.
Absolutely.
Which I feel in the West still it's been addressed. In Pakistan, generally people don't even know that how they can take care of themselves with all these physiological changes that have occurred, which will affect from them from head to toe, internally and externally.
Absolutely.
So I think it's going to be another very big topic, which we all will be now discussing. And I think a woman's health, perimenopausal and menopausal, is something, another challenge which dermatology and aesthetic dermatology will take.
There's a certain degree of taboo too. There's certain topics that just considered sort of taboo. You can't talk about it.
Yeah.
It's a hush hush. It's okay. Just, kind of pretend it's okay.
It's a time, you're aging. It's okay. It happens with age.
Right.
It is a part of you.
Like you're not supposed to just shut down your life now.
Yeah.
You're supposed to continue to live in a very optimized manner.
Exactly.
Still feel good, have a good body, and still enjoy your life. Not feel sick and just, kind of
exactly
wait to be done.
Actually, women were always kept in a certain, within boundaries of everything,
Right.
Now with the empowerment, education, and their self-reliance, they're beginning to evolve themselves. When they're evolving, they're taking care of themselves, their health, their well-being, their mental health, the physical health, the personality, the aura, everything. So I think lots is coming for women. Good challenging years and good, nicer. Yeah.
I'm excited. I think dermatology, aesthetics, it's like there's a lot of different layers.
Yeah.
It's about self-care. It's about, taking care, just being good in your skin and just, kind of.
Yeah. And not only about women, I think men in general. I didn't see men coming and, a lot of time taking time out for themselves. I see that as well.
It's starting to come.
Yes.
For their self-care.
Yeah.
Self-love.
Their hair, their face. Yeah. That I never thought this product is essential. Please guide me. So there is a kind of a new, chapter that's been opened, and it's exciting, and I'm exciting for all of us.
All right.
To be in
Thank
it.
you so much. Thank you for your time.
Pleasure
So nice
meeting.
of you. So there you have it. Take care of yourself, love yourself, and involve inside and out to have great looking skin. Thank you so much.